Without question, it's bipolar disorder. There are 5 subtypes, but the most common one is bipolar type 2, and it's also the most dangerous type. It has the highest risk of suicide because in bipolar 2, which is not well understood by a lot of doctors, it's mostly chronic depression every day to one degree or another. You might be a little less depressed one day, more depressed, and then maybe once or twice a month, maybe sometimes more often, but not very often. If somebody wakes up, they feel a little better, they've got a little more energy, a little more optimism, they can get out of bed easier and get some things done. But the next day, bam, they're back down in the middle of that depressive sphere. And the official diagnostic manual we are supposed to use for many, many years said you had to have 7 days of hypomania. Hypomania means less than manic. Full-blown mania are people that are very ill and they're psychotic. And hypomania means it's a milder version, and they don't get so ill. They aren't hospitalized for this. Somebody has a full-blown mania will end up in the hospital. Hypomania is milder, but the book said you had to have 7 days in a row. And nobody has 7 days in a row, maybe very few. And then it went down to 3 days in a row. But very few people have 3 days in a row. So half of all cases of bipolar type 2 are missed because the diagnostic criteria are incorrect. And there's real research by great researchers proving this. So they all get diagnosed with major depressive disorder, and that's a huge mistake because people are given antidepressants for that, and that makes bipolar disorder worse. So that's a big problem because there's a lot of misdiagnosis or undiagnosis, and the drugs they use make people worse. Antidepressants, in my experience, have been known to cause suicides in people with bipolar depression because it makes their depression worse, not better. So that's a big problem. So when people come in here, some of them have been on antidepressants for 10, 20, 30, 40 years, and they've never ever gotten well. And you'd think somebody would think, well, maybe we got the wrong diagnosis, but they don't. So I tell them this story, and I said, you've been undiagnosed all these years, and if we use the medicines that I use, you'll get well. And it's rare that people don't get well. It's a class of drugs called mood stabilizers, and they work like a charm. And when you treat people with those drugs, they get well, and they stay well. And they are willing to do this because they've spent all these years never getting well. So that's kind of it in a nutshell, really.